Well, VST is a very safe process. I have been a VST patient for well over 10 years about the outcomes that we can achieve with VST. Secondly, there have been numerous studies across the United States as well as North America and China and Asia where VST has been shown to be both efficacious and also safe. For patients who are considering VST, we'll go over your personal care regimen, and that will minimize the potential for challenges. Can my prescription be corrected with VST? If you're nearsighted and you are between the ages of, say, 7 and 107, there's a good chance you might be a good candidate. To determine whether or not you are specifically suitable for VST, that requires us to take a look at your eyes utilizing some specialized technology which gives us indicating factors for your level of corneal change and the resultant clarity in your vision. How will I know if VST is right for me? By coming in for a consultation, we can do an evaluation of your eyes in a very relaxed, non-stressed environment to give you some good information so that you can make a wise choice regarding your vision correction. We believe that a patient who is informed is a much better patient in terms of outcomes because they know what to look for, they know how to manage, and they know what is good or bad, and we can make adjustments based upon the information that that patient gives us. Will I still have to wear glasses or contact lenses after VST? VST, once an optimal shape of your eye is achieved, most patients do not need to continue wearing traditional contact lenses or glasses. However, if you require bifocals, if you're in that category over 40 where you happen to need bifocals while using your glasses or bifocals while you're using your contact lenses, then you'll likely still need to have some fine print help with VST. There are a few options which are not covered in this particular promotion that we do have available. There are some of our premium vision correction options for those of you who happen to have need for it, and those can be discussed at the time of your consultation. With VST, how long will it take before I will be able to see well without glasses or contact lenses? It depends on how nearsighted you are. So if you happen to have a fairly high prescription, then it's going to take a little longer for your eyes to bring an image into focus, and so your expectation should be that it'll take a little longer. However, if you have a very mild prescription or a low nearsighted prescription, you could conceivably walk out of the office without any need for vision correction in as little as an hour. We've seen patients with low prescriptions get corrections in a matter of 30 minutes. On average, however, vision stabilizes in about 7 to 10 days for low myopes, in about 14 to 21 days in mid to moderate myopes, and about 30 days in patients who are on the high end of our myopia scale. Is VST permanent? Thankfully, no. VST is one of those processes that allows us to make adjustments without having to completely redo a vision correction. VST is a process of gentle corneal molding. So we actually shape the cornea optimally, and then we put a retaining lens on so that the cornea will maintain its shape. By removing the retaining lens, the cornea over time will begin to drift back towards its baseline, and that is in some ways an advantage of this process. How much does VST cost? We thought it would be a good idea to give the listeners of WPZZ an opportunity to have something a little special, and so we decided to do a special introductory offer of $6.99 per eye, which is half price, and that is for our basic vision correction process. We do have some specialty processes, and we'll let you know if you qualify for those, or if you are interested in those. We'll be happy to discuss those additionally. Is VST covered by insurance? VST is not covered by insurance, and insurance typically does not cover processes that are considered elective. Insurance typically covers things that are health related, and VST does not treat any illness. It is mainly used to reduce the blurriness associated with myopia or nearsighted. What is vision shaping treatment in summary? The shortest way to describe vision shaping treatment is this. Vision shaping treatment is simply the precise application of specialized contact lenses worn overnight that results in a well-shaped eye, and that well-shaped eye brings an image into focus. And when that image is brought into focus, patients see well. It's very simple. When the lens is removed, the eye maintains that optimal shape. They see well with the contact lens in, they see well with the contact lens out. It's very, very simple. It's something that's non-invasive, it's fairly comfortable, and we find that patients respond quite well with it. Our treatment also consists of monitoring the process and the progression of their vision throughout the treatment regimen, both through the initial care stages as well as the maintenance stages. And so it's very important to try to let you know that VST is not only a comfortable process, it's a process that's well planned, it's well monitored, and we see excellent outcomes for our patients. And we are looking forward to having WPZZ partnering with us for a while on this project, and we look forward also to having you visit our office. Again, I'm Dr. Ken Brantley, and it's a pleasure taking some time to answer some of your questions about VST. If you have additional questions or you'd like to come by and visit with us and have a free, no-cost consultation, we'd be happy to have you come in and answer further questions. You may visit our website or by clicking on vrcvision.com and simply click on the appointments link, and we'll be happy to see you. If you are a WPZZ listener, you'll need to mention WPZZ in your appointment scheduling to make sure that you get the WPZZ price. We hope that this has answered many of the questions you may have about VST. If you have more specific or unique or individual questions related to specifically your care, we invite you to come by our office at 530 East Main Street, suite number 330, and have a free consultation. Schedule one with our office by visiting vrcvision.com, or simply call us at 804-643-0546. We look forward to seeing you at our office, and thanks so much for taking time out of your busy schedule to find out a little bit more about VST. Thank you.